The Thames Valley Letby is a small confined area which allows us to use the 5 teaching trusts that we have in the area. They are large major trusts with high delivery rates, and so there's plenty of training opportunity of all aspects of obs and gynae. We've got one teaching hospital at the Oxford John Radcliffe Hospital, which has departments that cover all the specialities that one wants in obstetrics and gynaecology. We have an academic unit, so trainees who are interested in academic training can progress in that. By being fairly small, it's very personable, and it's easy to commute between the different trusts for trainees who have to rotate through all the training areas. We've had pretty good results. There are 2 exams, Part 1 and then Part 2 MRCOG of the Royal College, and over the years we've had some excellent results, and about 1 year ago we had a gold medal winner. We've had them fairly regularly, and we have a very good teaching club once a week for Part 2, which is the clinical exam. As trainees leave us, we've had good recruitment into consultant posts. These days quite a lot of trainees will go into locum consultant posts, but our trainees are finding good posts and teaching hospital posts as well, so we're very pleased with it. Obstetrics and gynaecology is a very exciting field. It incorporates two disciplines really, which come together which follow the needs of women's health care throughout their reproductive years. It combines medicine, it combines surgery, and it also is a speciality where many of our patients are well, and so we can enjoy planning their pregnancies. So not everybody's very sick, but at the same time we also have patients who are extremely sick and need a lot of rapid emergency responses. So it gives some excitement if trainees wish an acute speciality. So, on a more personal level, I have really enjoyed the combination of the specialities and the variety that each day brings, with never knowing quite what to expect. And the really special part is to be involved with a patient's delivery, and that first hour of a new baby's life is a real pleasure and privilege. We are looking for good clinicians because we need trainees to be able to assess patients medically. We are looking for trainees who have a potential of surgical ability and hand-eye coordination. We're obviously going to train in that, but we need to know that you are able to be spatially aware, because we're doing more and more laparoscopic surgery. So other qualities we're looking for is to have good communication skills. Particularly need empathy with times when they're quite difficult situations we're dealing with. We're looking for trainees who enjoy working in a multidisciplinary team, because we work very closely with our other professional groups, the midwives particularly, and you learn from them as well as from the obstetricians. And an area that we really do need is trainees to have some resilience, because it is at times a very demanding speciality with crises that need to be sorted out, but they do balance the good, more gentle times as well. The RCOG, which is our professional body, has just brought out a new report called Tomorrow's Specialist, and it's looking at how the focus on improving the quality of women's health care in the span throughout the reproductive years can be affected. It's looking that the service is going to be increasingly consultant delivered, that trainees will be involved within that, but in possibly more of a training capacity, and the acute out-of-hours care will be delivered by trained specialists. So trainees who are looking to investigate a little more about obstetrics and gynaecology might like to read that article that's on the RCOG website. As consultants move to delivering more out-of-hours service, I think our job plans are going to change with the out-of-hours on-call commitment, but that means that there will be time off in daytime, and that time can be used for a variety of domestic commitments or for other portfolio aspects to your career. So it's going to give you plenty of time to enjoy other aspects of obstetrics and gynae or home. The changes in service delivery with more focus into the community are going to mean that many specialists will work across primary, secondary care in the community, and alongside the development of a new faculty called the Faculty of Sexual Reproductive Health, where there'll be community gynaecologists, and the obstetricians and gynaecologists will be working together with that group. So there will also be development of networks, so that there will be larger central hospitals with satellite smaller units. Through the training scheme, we have a 7-year run-through training scheme which takes you to CCT at the end of the 7 years. It may be that some trainees don't want to go all those 7 years and perhaps will stop after Part 2 MRCOG and enter a speciality doctor role. These are trained posts and they provide service into the department, particularly for some out of hours on call, but also they allow them to develop, the specialty doctor to develop a special interest and provide a very important role into the department with a very specific skill. Through the training scheme, after the 6th year of training, some trainees will choose to enter subspecialty training. We have 4 subspecialties, and probably overall about 10 to 20% of trainees will move into these areas. However, all the other trainees will also, in the last 2 years of training, have 2 advanced training skill modules which are speciality interest. And so you'll be a generalist, but with a special interest in a specific area. Less than full-time training is being asked for more frequently these days. And in this Let B, we're developing more slot shares so that trainees can train flexibly. And that will then lead on to trainees wanting to look for consultant posts that are less than full-time as well. At the present, there are not a large number of consultants who work flexibly, partly because you can concentrate your hours into one half of the week and perhaps have one day where you're not committed to your trust. But there will be more part-time posts available in slot shares, because I think the speciality is recognising that our workforce is becoming increasingly female and some will not wish to work full-time. In terms of work-life balance, I think we as medical professionals, we know that we are serving our community, and so we are having to put a lot of time into this, but there is the way the work pattern, the rotas now are, we can also have plenty of time off to enjoy our home lives as well. In terms of applying to the speciality is to work out whether it's a speciality that suits you. In your undergraduate time, did you enjoy it, the attachments? Go and talk to some of the foundation trainees and the ST1-2s who are doing the speciality, see whether you like what they're doing. Within the foundation program, there's time to take a taste a week. Go and have an attachment at one of your own G units. Your foundation supervisor will be able to coordinate that for you. Then look to get some more information for yourself. Go into the RCOG website. There's a very good careers page on that, and with a lot of information, a lot of frequently asked questions. The RCOG has an annual day for careers fair, which you can welcome to go along to. And they also have essay prizes, particularly for undergraduates, that you can apply, and that will help onto your CV. When you are applying for the ONG posts, it's all part of national recruitment, so make sure you keep a note of the timescale, that the jobs are all advertised on the ObsJobs website, which is accessed through the central portal for applications, and there is a timescale that needs to be addressed. Make sure your basic life support qualification is up to date, because that is the only specific requirement. You do not have to have passed any of the exams. The college exams are not expected before you enter training, although if you really want to, you're very welcome to do them. Make sure your portfolio is up to date and showing reasons why you're interested in Obs and Gynae. Entry into ONG training is only at ST1, and the person specification for that is you must not have done more than 18 months training previously. And that counts worldwide. That does not include any jobs you've done at foundation level. But if you have done work intermittently in obstetrics and gynaecology, you do have to add it up, because 18 months and above you cannot apply.